Well, no, I really appreciate everybody staying all day waiting for this presentation. But I have some disappointing news for you. You have cancer. So these are words that nobody wants to hear in their lifetime. But you may not realize that 1 in 3 people in this audience will hear them sometime. Now, it's absolutely essential that a diagnosis of cancer is accurate and ideally a test that's non-invasive. So I'm really pleased today to tell you about Nanostics' new platform, ClarityDX, and our new prostate cancer test that's being released shortly to detect aggressive prostate cancer. So you may not realize this, but the way we screen for prostate cancer right now is not ideal. So normally we use this test called the prostate-specific antigen test. And I have several graphic images to describe how prostate cancer is screened. So it involves a family doctor visit, a blood test which is non-invasive, a digital rectal exam which is invasive. Unfortunately, the PSA test is highly sensitive, but not highly specific for cancer. And we do over 80 million PSA tests a year worldwide. But to get a definitive diagnosis of prostate cancer, one needs to submit to a prostate biopsy. And this is not an innocuous procedure. So it requires transrectal ultrasound, guiding up to 14 needles that are pressed through a very sensitive area of the body into the prostate, which is an organ the size of a walnut and that sits under the bladder. As you can imagine, being in this sensitive area as well, prostate biopsy comes with significant potential side effects. So besides obviously the invasive and the uncomfortable nature of the procedure, it comes with a significant chance of infection, right? And up to 5% of these infections can result in life-threatening sepsis. So ideally, biopsy is not the best way to diagnose prostate cancer. On top of all of this, 75% of men who get biopsies don't actually have prostate cancer at all. And what's more important as well, 90% of all men who get a biopsy don't have prostate cancer that would benefit from treatment. So really, there's a significant clinical unmet need for a non-invasive, simple blood test that can predict whether patients have aggressive prostate cancer to select them for prostate biopsy. So our solution at Nanostics is called ClarityDX Prostate. Now, it actually hijacks normal messages that go through the body all the time. Basically, they're called extracellular vesicles. You may know them as exosomes. They're basically little vesicles that go around the bloodstream, millions and millions of these in a single drop of blood. Now, normal cells in your body use these to communicate throughout the body, but in the case of a disease patient, the format, the makeup of these extracellular vesicles changes considerably. And so we have a microflow cytometry assay that allows us, in just 2 drops of blood, to detect up to 5 million individual vesicles and interrogate them with multiple biomarkers. And that's what ClarityDX is built on. So just imagine you have 2 drops of blood, 5 million vesicles with 4 biomarkers. We collect up to 20 million pieces of data per patient. This is complicated, and a human can't figure out the pattern. So we're using a sophisticated machine learning approach with a training set of patients to basically derive a very specific fingerprint of the disease state, in this case, aggressive prostate cancer. And the machine learning aspect of it adds over 10% of accuracy to the test. So how do we know it works? Well, in Alberta, we've done a prospective study in 5 centers recruiting patients who have not yet been diagnosed with prostate cancer. And basically, comparing it to PSA alone, ClarityDX was 40% more accurate at a high sensitivity at predicting which patients had aggressive prostate cancer. Nanostics is about a year old. We've raised seed funding. We've made key partnerships with clinical providers that are going to be running our real-world clinical validation trial. And we'll get our first sales later next year, heading toward rapid FDA and regulatory approval. After FDA approval, we want to beat our competitors to market because there are no other FDA-approved tests for this indication. We'll have a significant impact. Once we're approved, we'll eliminate more than 1.7 prostate biopsies per year worldwide, resulting in up to $4 billion of cost savings to the healthcare system. The bottom line, though, is that we're going to improve quality of life for men and bring peace of mind to men and their families. Thank you.